This portion of Local Lifestyles is brought to you by UVet.
I'm back at UVet in Newburgh. This is Dr. Turpin, and today we're going to talk about a situation that I don't think of with pets. I think about myself having white coat anxiety or being kind of fearful of treatment. So what is fear-free and low stress for an office visit with you?
Yeah, so fear-free is a movement through VetMed that has resulted in certifications that our staff has gone through to be able to interact with the patients and their owners in a more low-stress way. Fear-free focuses a lot on the flow through the hospital. You know, do cats interact with dogs? Do dogs have access to getting to the cats? When they're in the rooms, can they hear what's going on outside of the rooms? And it varies by species, you know, so it involves thinking about, you know, what was in this room a moment ago a carnivore, a predator, and what's coming into the room now is an herbivore, right? And so it's going to be terrified because of the smell that was in the room.
So how do you manage that?
So a lot of it is looking at the different pets and kind of prioritizing the room space and regulating that. A lot of it has to do with having pheromones in the room. So we have sprays like the Feel Away there on the counter that we can use to help calm cats if there's maybe been a dog in the room. Sometimes we'll even spray them on ourselves so that we give off those pheromones to help calm the patient.
Which makes sense, of course. It's logical. And then you have all this array of goodies and treats and toys.
So food is one of the only things that innately causes the release of endorphins or hormones that make you happy, right? And so if we can get a patient eating, if we can get them playing, if we can get them doing something that makes them feel good, well then they're going to be less fearful of us the next time they come back.
And so, as you said, this is a field of study that you can be certified in now?
Yeah, so there's actually two different certifications. There's the fear-free certification, which, as I said, focuses more on the hospital movement as a whole, how we all work together as a whole. There is some focus on the individual patient as well. There's also the low-stress handling certification, which that one focuses more on how do I interact with the individual patient? How do I wrap a cat in a towel so they feel secure and safe rather than panicked and out of control? How do I tell a dog when I'm leading it through the hospital with a leash where we're going and what direction I want it to go so that it's not, you know, just kind of confused out of its mind? How do I pick up a fearful dog in a way that is not going to make it more fearful and risk a bite occurring, right? How do I read their body language? And so that I know, you know, if what I'm doing is worsening their fear or alleviating their fear.
This is beyond your vet training then, isn't this? Is something extra?
Yeah.
And so apparently you're excited about this.
Yes.
It really works.
It does. It really does. We have pets. I work with a lot of kids that have behavioral issues that they walk in the beginning and they're terrified of us. They're lunging, they're growling. You know, they've learned that you walk in the room, you're going to do something unpleasant. The only way I can keep you away is by biting you, right? And so we work with them, and in some cases, we are actually able to decrease their fear to the point that, you know, either through sedation, drugs, these techniques all combine together, we get them to the point where they maybe can't let us do an exam awake, but we can interact with them, play with them in the room. They're happy to see us when they get here. They take their nap, they wake up, they go home, and nothing bad happened in their mind.
So is this something that the pet owner asks for, or is it just something you naturally just do when you have a visit?
Well, I naturally put fear-free and low-stress handling into every visit that I do. Now, that being said, things like sedation and all that, we talk with owners about that based on how their pet is doing and explain why we're recommending what we recommend. Now, we also do fear-free visits, which are pre-planned, scheduled 15-minute visits with a technician or a veterinarian where the pet just comes, they play, they interact, they get food, or sometimes we'll work on specific things, like I'm going to touch you in this way, and it's okay, here's this food, we're going to feel good about this, it's okay, and we move in a very slow manner, and we teach them that these things are safe, that they're not dangerous.
It's getting them acclimated to the space and to the people.
Exactly.
So the next visit is drama-free and fear-free.
And those visits are free, because for us, that is investing in our patients so that it's safer for them, it's safer for us, and they're happy to be here, rather than when they're sick, we push their stress over the limit and risk making them crash because of stress.
Dr. Turpin at UVet, fear-free and low stress. We'll be back with more lifestyles right after this.
This portion of Local Lifestyles is brought to you by UVet.